Jump into it because we've got a great topic today, and I will introduce you. So our topic today is make it chewy. So talking all things chewing in myofunctional therapy. But I would like to probably welcome you, Dina from Brooklyn Myo. Dina,
Thank you.
and a bit about you. So Dina supports children and adults with orofacial myofunctional disorders and teaches speech language pathologists and allied health professionals how better to address airway health, sleep in their own clinical work. She's deeply committed to ongoing learning and to helping families find meaningful answers when navigating concerns around growth, development, sleep, and behaviour. Very much aligning with the space I work in. But with 20 years experience in speech language as a speech language pathologist, 10 years as a teacher, a degree in educational leadership and extensive advanced training and mentorship, Dina just brings both clinical depth and educational expertise to her work. Those foundations come together in her comprehensive course for speech language pathologists, the Myo approach. And you believe in healthy breathing being the foundations of healthy and happy life. So do I. And her mission is to help professionals and speech pathologists, and probably parents as well, recognise that powerful impact of myofunctional therapy. So yeah, welcome.
Thank you so for this beautiful welcome and beautiful introduction, and thank you for having me. I'm humbled by this invitation, and I'm really excited to talk about chewing today.
Yeah, no. Well, for anyone new to your work, I would love you to share just how, as a speech pathologist, you came into myofunctional therapy, because it's not often the space we get into as speech pathologists. So, what sparked your interest in chewing, feeding, oral development?
Okay, so I'm going to tell you this. I have been in the myofunctional world the past 6 years of my practice.
Mhm.
And as you said, I've been practicing for 20 years, but I'm going to go back to over 20 years ago when I was doing my internships, my externships in a hospital setting back in 2002.
Mm.
I graduated with my 2004. I graduated at the end of 2005 with my master's in speech. And so that year I was doing an internship in a hospital setting with adults.
Mhm.
And, typically in a hospital setting, you're treating adults with dysphagia,
Yeah.
swallowing and swallowing disorders. And I actually loved the medical aspect of the field. But having come to, like, I switched careers. I was teaching for 10 years.
Yeah.
And I knew that I wanted to continue working with children. So I love the medical aspect of SLP, working, with swallowing and swallowing disorders, but I knew I wanted to do it with children. And so straight out of graduate school, I started specializing in feeding and oral motor. So I have been doing chewing for 20 years with the littles. So the myofunctional therapy aspect, my dear friend Alana from Bonder Speech, who is an apraxia specialist, reached out to me 6 years ago or so, maybe a little longer, and said to me, someone reached out to me and said that their child is a tongue thrust and they want to, book an appointment, and I'm not sure what to do. I said to her, I'm not sure. Is that like a lisp? And then I thought, and then I hung up and I called her right back. I said, no, Lana, it's not a lisp. We need to like do some more digging. We need to understand tongue thrust. Like, what exactly does that mean? We knew it was related to swallowing a little bit, but we had no idea. And then I literally rabbit hole is an understatement. Once I got into it, kept on going deeper and deeper.
Yeah.
And when I get into something like with feeding, I also wanted to have an expertise. So I took all the training out there. I traveled across the country and I took all the oral motor training with Talk Tools and with Deborah Beckman and Lori Overland and Catherine Shaker. And I took courses on treating patients out of the NICU and how to wean children from feeding tubes, from like the G tube and all of that. And so same thing with Maya. Once I got into it, I was like, I want to understand it. I want to know it. I want to really get the concept. And every time I took a Maya course, I was like, there's something missing. I need another one. I need another one. So before I knew it, I took like so many courses and multiple certifications.
Yeah.
Because I really want, and plus I took a lot of courses on like tongue ties, and I took the Munchee course. Wanted to become a Munchee certified practitioner. And I learned so much in that course. Now I have the baby course to complete.
Yes. Oh,
But
that's a
yeah,
good
that's
one.
basically how
Yeah.
I got into Myo.
Yeah. Well, I think it's a pretty common story of that, just down the rabbit hole and just always wanting more, which is, yeah, certainly the
Yeah,
space that I'm in. And I don't think I feel like every time you do a bit of training in Myo, you learn more, which is, yes,
yeah.
it's such an exciting space. But back, we'll get onto our focus of today, which is chewing. And yeah, your expertise around from being feeding therapist into Myo, I think is just so powerful in that chewing space. From your clinical experience, what does chewing play beyond just eating? So particularly for jaw development, oral tone, saliva, airway support. So what does chewing beyond
So
just eating?
chewing beyond, first of all, we know that movement, this is how I explain it to parents. We know that movement allows for bones to grow and develop, right? Babies, bone gets stronger as they move more. They begin with crawling and walking, and then they're running and jumping, and that helps the bones grow and get stronger. Same for jaw bones.
Yeah.
Movement, just like walking is movement that helps with bone growth and development. Same with the jawbone, right? So chewing allows for that proper development. But beyond that, we need to have proper chewing for SH, CH, and J. Our molars should come in contact for these sounds. And so if a child is not able to produce them, assess their chewing, make sure their molars come in contact, work on chewing, and then work on speech. I mean, when it comes to these particular sounds, and this is I share a lot on my page to SLPs, but I want to tell parents because this is something very common to those of us in the Myo world. I just want to clarify that myofunctional therapy is a modality that us speech therapists do. So a lot of times we get critiqued by leaders in our field that we shouldn't say we're myofunctional therapists. We should say we are a speech therapist with specialty in myofunctional therapy. And so what I like to say is that if your child has prolonged articulation deficits, and they're in articulation therapy using traditional approaches and they're not making progress, they need a myofunctional evaluation because they likely have some underlying issues. Specifically when it comes to CH, SH, CH, and J, chewing is very much connected to that. So if your child is not doing chewing well and they're not producing these phonemes, work on chewing first. But we really need to, again, do a full evaluation and see why a child is not making progress using traditional approaches. Whether it's mouth breathing, low tongue rest posture sets the stage for everything, for swallowing, for speech clarity, all of it. And so we need to make sure that we're chewing well for that as well, for speech. So that's beyond growth and development of the jaws.
Yeah, no, definitely. And I think, that's our role as a speech pathologist and my functional therapist is just to look outside that box sometimes. And yeah, that's certainly where I sit in the community that I'm in here in Australia. We do have access to a Why Children Must Chew guide. So if you comment chew today on today's live, that will be sent to your inbox. So keep that in mind.
It's a great guide.
Chew. Yes,
It's a great guide. I encourage you to comment and get the link to the guide. It's fantastic.
Yeah, it's great for parents, great for practitioners. I've really enjoyed sharing it with my families. So our next question is around, I guess, changing diets. So we often see kids who prefer the soft diets or avoid chewing. What are some of those common signs you notice in chewing skills what are some of the common signs you notice that chewing skills are not developing as expected?
So going back to talking previously about, molars coming in contact for chewing, but really the mechanics of chewing requires the jaws to come together using our molars, but also the tongue needs to move freely laterally. So we take a bite, we chew it on one side. We want to have we use both our sides for chewing, not just one side. So unilateral chewing, sometimes when kids chew on one side, that one side could become overdeveloped and the other side is not. And we see that sometimes we see asymmetry. We need to have very good tongue function, proper tongue function for proper chewing.
Yes.
And so if we have limited mobility of the tongue, limited movements of the tongue, what we call limited range of motion, that's going to impact on chewing. And, you know, very often due to a tongue tie. So tongue tie will limit the mobility, the movement of the tongue. And sometimes babies breastfeed well with a tongue tie. Sometimes humans are very good compensators, okay?
Yes.
So sometimes babies will compensate with breastfeeding, but then parents will say, oh, my child is not transitioning well to solids. Sometimes we'll see gagging, choking, just refusing to eat things, foods that require more chewing.
Yeah.
So they stay on a soft diet because of a physical limitation in the mouth.
Yeah.
And so if your child is not progressing with textures, they're not, they're just they're stuck in the softer textures. You want to know why. Kids don't just wake up one day and say, I want to be picky. I don't want to eat these foods.
Yes. Yeah.
We are pre-wired to love food. It's a pleasure of life.
Yeah.
And if a child refuses certain textures, then there's also the sensory component. Eating is a sensory motor experience.
Yeah. Yeah.
So we have the chewing aspect and we have the sensory aspect, and they're very, very much connected.
Yeah.
And so if we have limited tongue mobility, we're going to have difficulties transitioning. But I do want to say is that sometimes kids progress okay, but the quality of their chewing is not good, and they're mashing the food and getting by. They can even eat steak like that.
Yeah.
Okay?
Yes.
It doesn't mean that the quality of their chewing is good. You want to pay attention to what we call a mature rotary chews. We want to see the jaw moving from side to side. We don't want to see excessive jaw movements, but just enough. So we're taking a bite, we're chewing it on one side, we're moving it to the other side, chewing it well enough, bringing it to the middle, and then the swallow requires the tip of the tongue to be up here. And no involvement of the facial muscles. So early on, it's okay to see it, but as a child gets older, tongue up. So if you're seeing the child doing this when they're swallowing, excuse me, that was a bit exaggerated. We see that more often with younger kids.
Yeah.
But what we want to see as kids get older and you say, chew with your mouth closed or swallow with your mouth closed, you might see engagement of the lip muscle. So you might see this. And we shouldn't be seeing that.
No.
One way to test it is ask your child, like you can't do it with a 2-year-old, but children that are a little older, take a sip of water, bite, smile, and swallow. So we do this. If they're able to do that, that's pretty good. But if you see the liquid coming out, that might be an issue with their swallowing.
I love that little trick, and to show parents, they're like, oh, no, they don't. I don't think they swallow like that. And then that nice, clear example. Obviously, this isn't how we swallow, but a nice example of what the tongue does. I talk about safety a lot with just touching on so if those oral skills are not there, then they're not feeling safe in their feeding experience. Their brain is telling them this food's not safe, my tongue isn't protecting my airway when I swallow. And then that sort of cycle can begin in food fussiness. And so
exactly. I always say kids are not just like, as I said before, they don't just wake up one day and decide to be selective. If a child is selective, if they're picky, as some people don't like using that word, if they have a limited diet, then there's an underlying issue in behaviors, feeding behaviors. And I've done behavior feeding for many years.
Yes.
They always stem from somewhere.
Yeah.
If your child is giving you a hard time, they don't want to give you a hard time. Yeah. We're meant to enjoy food. And if we have a hard time with food, then there are underlying issues that need to be, addressed.
Yeah. Yeah.
So we have to do our, an assessment and see what what those underlying issues might be.
Yeah. No, 100%. I often speak about when I'm presenting a client I've had more recently, he was 8 He'd been in speech therapy a long time for feeding as well as speech, and he had no tongue lateralization skills.
He wasn't moving the
He
tongue from
was
side to side.
unable to move this. The reason they found me was because he swallowed a whole lollipop, and his speech pathologist
Wow.
went, maybe contact Kelsey. She does swallowing and thinks she might be able to help us. And the first thing I said was, oh, can you put your tongue side to side? And he was like, like that was him moving his tongue side to side. And so we've done a lot of work. He now can lateralize his tongue, and it was a lot of work, but we got there. And, you know, that skill should be coming in, we know, from like 9 to 12 months of age. So if it's not integrating way back then, what is that reflex doing? And yeah, we can start having those food avoidances from there. And he was a very good example of that. Okay, muscles weren't working in the way he needed it, but what were they? Chicken or the egg, because he avoided those harder foods to chew, and our muscles didn't develop for 8 years. So, but
Right, right.
now he's feeling safer. He's taking on a steak. It's really
That's
exciting.
amazing.
Yeah.
That's
Yeah.
Don't you love your job? I love my
I
job.
do.
You get kids to eat. You know what it
Yeah.
is? You know,
Breathe and sleep.
having been a feeding therapist for 20 years, I can tell you it's life-changing for families, because I know all of you parents who are here on this live, I know that how hard it is to struggle with feeding. And sadly, I don't know how it is in Australia, but in the United States, doctors don't listen to parents when it comes to feeding.
No. Yeah.
They really don't. They say, oh, your child is gaining weight. Great, wonderful. But they sometimes don't realize that it comes at the expense of a mom or caregiver or, you know, dad feeding their child around the clock.
Yeah. Yeah.
To get them to gain weight because they're having difficulties with, you know, whatever it is, you know, textures, flavors, volume, you know. And so I wish, I don't know if the pediatricians in Australia validate moms when they go in. But here, certainly, we have a lot of work to do because I feel like feeding therapists should be more respected and understood. Meaning, if a parent comes to the pediatrician saying, you know, my child is having a hard time with textures, or, you know, they're just not eating, or they're so fussy, the pediatrician should say, I'm not an expert. Here's the name of an expert. Get your child evaluated.
Yeah. I'm the first to do that. If I find something that's not in my expertise, I'll send them on. So yeah, I agree.
Right.
Yeah,
so
definitely.
all you parents here, you know, I hear you. If there is any struggles, sadly, the pediatrician is not the person to go to ask for help. But if you have gotten help from a feeding therapist, you could let your pediatrician know. They could hear from parents too.
Yeah. Yeah. No, definitely. Good, great insight and point. So I love to, in these lives, give parents some really realistic things that they can kind of take away and make change. Obviously, if you are very concerned, we seek out a practitioner, jump on the Munchee website and see the certified practitioners listed. Like, it's a great place to start because it's pretty worldwide. So it's not taking away from needing practitioners' support, but for those families just wanting some support and chewing at home, what are some realistic ways to introduce more chewing and without turning into like mealtime battles? What are your tips?
Couple of tips. Number one, use the Myo Munchee. It's the best tip. I want to tell you something. I see a lot of success with the Myo Munchee. A lot of success. Whether it's to get a child to chew more, whether it's to work on rest posture, eliminate oral habits like pacifiers. If you are having a hard time eliminating the pacifier, use the Myo Munchee. Thumb sucking habits, use the Myo Munchee. With prolonged use difficulties, it's, you know, I would advise if you try with the Myo Munchee and you're still struggling, then work with a practitioner. In terms of chewing, present pieces of food. If when it comes to babies, present bites of food on the lateral molar ridge, even if way before they have their molars. Present the food on the side, and you'll see these up-down movements. Now, to get the tongue to lateralize, what we do is you take sticks of food. We use, in therapy, I use veggie straws. You know, those stick, I don't know if you have veggie straws in Australia.
Yeah.
But if you want to go healthy, you can do puffs, or you could do, they're not so healthy, but they're easier with younger kids. That if you're afraid that your child is going to choke, those puffs that kind of melt in the mouth.
Yeah.
What you want to do is you want to have your child take a bite and then right away go to the other side. So we do bite and then bite. And that teaches the tongue to move from side to side. So when it comes to myofunctional therapy, it's for children over 4 because it's more active, it's more passive. Active. We actually model. Let's say we say, okay, I want you to move your tongue from side to side without wiggling your chin, right? We can't do that with babies.
No.
But we can teach babies to move their tongue from side to side by placing food here, whatever it is that you're doing. It could be an apple stick or cucumbers or puffs or veggie straws, and right away go to the other side. And then let them chew and swallow.
And utilizing those primitive reflexes, isn't it? Finding those early reflexes and just, managing those. Yeah.
Right.
Yeah.
So once they do that, then you could do bite in the back and the molar and bite on the lateral incisor. So bite, and then you go bite. This is a technique that I learned from Lord Overland. Bite. And it will just, like you said, utilize those reflexes and get them to lateralize and also get them to use. We want to activate the masseters, the chewing muscles, right? Temporalis, the masseters, get those muscles activated for chewing. The other thing I want to say about chewing is that very often when we do our assessments, we see open mouth chewing.
Yep.
And that could sometimes be due to an airway issue. So if your child is chewing with their lips closed, open, and if the airway is obstructed, they're not going to be able to chew properly.
Yeah.
And when that is the case, very often, like you swallow air.
Yeah.
Okay, you're chewing, you're swallowing air, and that can cause indigestion. And very often, babies get diagnosed with reflux, but they're really swallowing air when they're chewing and swallowing.
Yeah.
And so we want to pay attention to that and try working on chewing with the lips closed.
I also talk to families about, think about when you're unwell. If you've got a cold and your nose is congested, do you enjoy eating food? If they are like that all the time, obviously they have to compensate to make sure they can breathe, and can't taste it, not enjoying it. So definitely you'll see that first sign of very vertical, open mouth chewing. Yeah. No.
Right. And then that sets the stage for swallowing. So if your tongue is here and you chew with your mouth open, you're going to end up with a tongue thrust swallow. And we want proper swallowing with the tip of the tongue up. And when we swallow, what happens is the back of the tongue hits the uvula. You know that thing hanging in your throat when you look all the way back, you see that thing hanging? It's called the uvula. We want the back of the tongue to hit the uvula when we swallow. So when the tip of the tongue is up here and the teeth are closed, we get that light suction as we swallow, and the back of the tongue hits the uvula. But when our tongue is here, when we're chewing, it's going to set the stage for the tongue thrust swallow. So it's a ripple. One thing leads to another.
100%. Yeah. No, absolutely love that. What do you have? So you mentioned the veggie straws and those puffs to initiate a chew. What would be maybe 3 foods that you would add into? It might not be at a meal time, because I often talk about meal times being family time and times that you do focus on getting those nutrients and getting those calorie dense meals, but snacks, I guess. So chewy things that will promote their chewing and chewing skills. What are 3 foods that you might add
in general, I would say, I don't know, but it could be anything that requires more chewing. Stay away from puree. Stay away from the pouches. Those things just perpetuate the tongue thrust.
Yeah.
And it doesn't allow for proper jaw development. So, there anything that I always say, I'm not telling you what to give your kids to eat. Use whatever is culturally part of your culture. Whether you eat Indian food or Australian, I don't know if there's specific cultural foods in Australia or American food. Try to stay away from processed foods. Wholesome foods, proteins, vegetables, fruit. Don't puree them into a smoothie. Let your child chew on the fruit.
Yeah.
Right? Acai bowls and smoothies don't allow us to chew, but a whole apple is great.
Yes.
Okay. Chicken, meat, raw vegetables, carrots, carrot sticks. All of these things allow for proper development.
Yeah.
Encourage our muscles to work.
Yeah.
So, a whole apple is a great thing to have your child just practice chewing.
Yeah.
Right?
Yep. And the big
carrot sticks are great. Cucumbers, peppers, if your child is not chewing so well, so peppers should come later because of the skin.
Yeah.
It's a little bit harder to chew on peppers. So I would not start with peppers. But I encourage parents to do baby-led weaning. Today it's called baby-led weaning, but I'm going to tell you that our ancestors didn't have pouches and baby jars.
Yes.
That's how they fed their babies.
Yeah.
So go back to, old times and just give your children whole foods, wholesome food. Stay away from the freezer section that has all the prepared meals, the mac and cheese and all of these, fish sticks and chicken nuggets that are pureed and processed, rather, not pureed, processed foods that really don't give our children opportunity to chew.
Yeah. Yeah. No, that's great. And I really think that's a strong point to finish on there, And I think we just need to get chewing. And thank you so much for joining me today.
Oh, my pleasure.
Such a pleasure having you
awesome. Yes.
Covering
I think
a little bit of what
question. We do. Yes, just a snippet, right?
Yes. That was a question.
There is one question from Nick. I like the Myo Munchee, and my child has used it in the past. My biggest issue with it is ultimately reason for discontinuing is use. It's because the tiny silicone prongs inside kept breaking off. That's not really typical. Was he biting really hard on the Myo Munchee?
I often see that
if
with
he
a
was
lot of
biting really hard
and jaw sliding.
Or jaw sliding, that it's not typical. It should not happen.
Yeah.
I've been using it for years with so many of my patients, and I also sell it on my website. It's a very it's a hot item. I haven't heard that, so it's very possible that it wasn't used properly.
Yeah.
Would you like to add anything to that?
I would agree. So I would always if we start seeing deterioration of the device, because they should last a very long time, it's just stepping it back. But also that the team here at Munchee, if you send them an email with photos and they will often problem solve, or send you off to one of the practitioners on the team to problem solve that. Or if looks like you might be based in New York, so not maybe too far from Dina, that you could reach out directly to her. But I think it is often about that use. So are the lips closed gently? Are the teeth sitting in it? We're not actually rotary chewing around and around and grinding, but we're just bouncing and working muscles. Yeah. Right. But a lot of the time it's that, or just having a little gnaw on the side of it.
Or biting on it.
Yeah.
Right. Here's another question. How to approach families who are worried about microplastics with the Myo Munchee?
Good question. Well,
it's made with silicone, so I don't think that it's a concern. It's medical grade silicone.
Yeah, and it really nothing should be breaking off, I guess that is why the advice is to, keep them clean, keep them dry. You have to care for them. It's not just chew it and throw it off to the side and let it be. And renewing them as well. Like they do last a long time, but it's just like anything. And anything you put in your mouth, ultimately, we do update our toothbrushes.
Right, so but I don't think there's a microplastic issue with it because it's made of silicone.
Yeah, yes.
And here's another question. My daughter also takes those little prongs off using it. She's 3. She, again, we went through, just try to use it properly. And then reach out to Myo Munchee, hello@myomunchee.com.
Oh, that's great. Thank you.
They'll help you out.
They really will. It's a beautiful team that will, really problem solve what's going on.
Yeah.
From videos to photos, they will, help you get through it.
Myo Munchee is the best customer service. They're wonderful to work with.
They'll love to hear that. They're all in the next room. So no, that's great. They were good questions, though. So thank you. And
yes, and thank you so much for having me. This was a great conversation. I could talk about this all day.
We could, yes. That's
so
why I had to be a bit specific
passionate
today.
about it. I'm passionate about helping families. If you want to learn more, you could follow along on my page. I have a free handout, like a free freebie, whatever, a PDF for parents about myofunctional therapy. So you could DM me. I could send you a link to that. I also developed a book for parents, an ebook. There's a whole chapter on Myo Munchee and the Lost Art of Chewing by Dr. Mary Burke, the CEO of Myo Munchee. She also teaches on my course. My course is for therapists, but I love Dr. Burke, and I love the work that she does and all of you do at Myo Munchee. And it was really, really a pleasure being here today. Thank you so much for having me.
Thank you for coming on, and we'll speak soon. Have a great evening.
Thank you so much. You too. Good night.
Good night.